You are watching Randy Alvarez Marketing Report. I'm Randy Alvarez. We're talking about the business of dentistry and the importance of labs. With us, we have cosmetic dentist Dr. Bartusiak. Dr. Bartusiak, welcome to the program.
Thanks again, Randy.
Thanks for sharing this on our marketing report. So the labs, you say probably one of the most important things.
The most important thing. Critical, crucial, whatever word you want to describe it. The laboratory's key. There's a triumvirate. The patient, the dentist, the laboratory. The patient obviously is important. Can't do without him. The doctor and his skills are important. But unless you have a lab that listens and works with you on a repeated basis, consistently, then you're going to have
now, like a lot of guys that come on my program, they think what they're doing is the best, or they have the best, but you think you have the best lab.
They're consistent in their product. They listen. If it isn't right, they'll make it right. And the communication with our staff and the laboratory, allowing us to take lots of photos and share information back and forth and have a dialogue as to how we can go ahead and create that smile, or even if it's, implants, bridges, etc., whatever it may be, whatever that case and the complexity of it could be, having a nice open dialogue and saying, why don't we try this, doctor, or did you ever think of this? And even bringing suggestions to the table as to how to make that better.
But doesn't every lab offer that?
No.
Or at least say that?
Did you know that 50% of all lab scripts are not read by the laboratory?
Interesting, okay.
Yes. They read mine. They'll read yours.
What other competitive advantages do you see?
Consistent pricing,
okay.
Consistent delivery, consistent on-time delivery, which is key, consistency in the product, consistency in what they do in terms of providing a product on time, doing it well, and if it isn't right the first time, they'll make it right.
Okay, and because this is a marketing report, a business report, that many dentists, and we've talked, maybe take the cheap way out, something 30% less, 40% less.
I'm all for it, right.
Right, but you say that's a business mistake. Yes. It's better to spend a little bit extra on a beautiful, tooth, or
yes,
authentic looking. Elaborate on that.
Well, when that tooth goes out into the junkie public's mouth and he walks outside, it has your name on it, doctor. That's the bottom line. It has your name on it. And if you want to do a cheap crown, and in life, many things you get what you pay for. And although this lab is very competitively priced, they're not the cheapest, they're not the most expensive, but they're the most consistent and they're the best.
What's the name of the lab?
EA Dental Labs.
Okay, good. And they're located where?
Mississippi.
And how long have you been using them?
3 years.
So 25 years you've been a cosmetic dentist?
Yes.
And so clearly, what's the difference when you think of this lab?
Communication.
So really, okay, you keep saying that.
Communication, it's key. They listen, and consistency. Consistency is probably the key thing. I can put a crown in every time and know exactly what it is that I want, and they deliver it. If you have any additional questions, please contact our office. We'd be happy to assist you. You may also request to meet with me one-on-one for a free consultation. We would be happy to assist you as well. Hi, I'm Dr. Barry Bartusiak, and I'd like to talk with you about invisible braces and a way of straightening your teeth, whether it's a lot of teeth that are crooked or whether it's one simple tooth that's just a little turn. It can be done in a much more efficient manner using invisible braces. Invisible braces are clear acrylic trays that slip on over your teeth. You take them out to eat, place them back in. With traditional braces that usually last on average about 36 months, clear correct braces or invisible braces would be about half of that time or even less.
So tell me a little bit about your background, your training, where you went to school, and kind of where your practice has been, where it is now.
Well, I graduated from Trinity High School here in Washington, Pennsylvania, and then I went to the University of Pittsburgh for 4 years undergraduate and became a dentist at their dental school at the University of Pittsburgh. After that, I went to the University of Minnesota for additional training as well as the University of Miami. Upon that, I came back home to practice in my hometown of Washington, PA. I became a dentist because I like helping people. I enjoy that.
Good. Now, you've had extensive training with dental implants, cosmetic dentistry. Elaborate on that after dental school.
Well, I've been the proud participant in over 1,500 hours of continuing education after dental school by going to classes about once a month to provide better care for our patients. whether that was in implants, cosmetic dentistry, invisible braces, sedation dentistry, all about taking better care of our patients and being on the cutting edge of technology.
So a big part of your practice is porcelain veneers and crowns.
Yes.
Tell me a little bit about that. Who's a candidate?
Anybody is a candidate that wants to fix their teeth, whether it's a chipped front tooth, whether it's a back molar that has all that black silver filling that they want to get transformed and look better, look more youthful, look in a better appearance, chew better. They can get a veneer, which a veneer would be on a front tooth. Crown usually is on a back tooth. Crown's a little bit stronger, veneer is a little bit more for cosmetics.
So who is a candidate for dental implants?
Whether you have dentures, whether you want to replace all of your teeth or one of your teeth, whether it's dentures that just snap on a couple of implants here in the front, or whether it's you want to replace a tooth in the back or even a tooth in the front. Dental implants can be a way of transforming one tooth or all of your teeth to a better smile, better function, etc. Titanium is what we use for dental implants. It's the same thing used in knees and hips, allowing us for your body to accept it and for us to go ahead and make your smile better.
So you use Clear Correct, clear braces. Tell me about it.
Invisible braces have just been a godsend to dentistry because they've allowed so many other people to go ahead and get their smile to the way they want it to look. It's a way of using acrylic trays on your teeth so that no metal is used. You're a candidate for invisible braces whether you have one tooth rotated or many teeth rotated, because invisible braces can just twist that tooth to the right point and in a very short period of time. Traditional braces usually 36 months, invisible braces about half of that time.
A big part of your practice, people want to be sedated. Tell me about that.
People enjoy sedation dentistry. I hate the dentist. How many times have you said that or heard that? I hate going to the dentist. This is a way of allowing them to be completely asleep with another doctor providing that sedation so that their safety is of utmost importance. I just do the dentistry. The other doctor does the sedation aspect of it. It can be with IV so that they wake up. They don't, there's an amnesia effect. They don't even remember that they're there. And they go and they got all their dentistry done at one appointment. Nice, clean, safe, and easy.
So whitening, big part of your practice?
Whitening is a very, very important part of our practice. Whitening is a big part of our practice as well. Whitening is done every day on our patients to provide them with a younger, more glamorous, attractive smile so that they can go ahead and begin the cosmetic dentistry aspect.
So what type of whitening are you doing, by the way? Are these trays? Are you doing...
We use Zoom whitening,
okay,
where you sit there in the chair for about an hour and 15 minutes and you start at this aspect, dark, dingy teeth, and you leave with a beautiful, bright smile.
So you accept most insurances in your practice?
We do accept most insurances in our office. We participate with certain companies and carriers, and we'll be delighted to contact those carriers upon your behalf and file with your insurance carriers for you.
So gum problems.
Gum problems can exist when you have puffy gums, bleeding gums, bad breath, bad taste in your mouth, and those can be fixed non-surgically. Nobody woke up in America this morning and said, wow, I want somebody to take a scalpel to my gums. We have a non-surgical proven method for the last 25 years in our practice that can eliminate those areas of concern and return those gums to health. If you have any additional questions, please contact our office. We'd be happy to assist you. You may also request to meet with me one-on-one for a free consultation. We would be happy to assist you as well.